All right. Well, thank you one and all for joining us for December's Health Innovation Community Partnership meeting. We are ready to get started. All right. So, as always, we want to make sure that you have we want to make sure that everyone has a great experience participating in our meeting today. So we're going to ask first and foremost that if you are not speaking, please go ahead and mute yourself so we can keep background noise to a minimum. Of course, you can always find the control panel at the bottom of your Zoom screen, which will give you access to various tools, including our simultaneous translation. So please do select a translation, or pardon me, a language of your choice so you can fully participate in our meeting. We also want to make sure that this is a very interactive session. So please feel free, as always, to take full advantage of our chat and raise a hand if you want to ask a question. We will hope to have time for questions and answers throughout our presentations. Before we get started and kick the meeting off, I will go ahead and read aloud our HICP guiding principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. So for today's meeting, we have several wonderful presentations. I'm sure you're going to really enjoy our time together. We will be hearing first, of course, from our fabulous CEO, Jorge Orozco, about how things are going on our medical center campus. Then we will have representatives from the Department of Public Works and the Department of Cultural and Civic Arts to tell us a little bit about projects on our campus and give us an update on where things stand. We will also hear an update on the LA County Metro Area Plan. And we have several presentations on the county and the city's guaranteed income programs, which are just launching in their pilot phase. We'll conclude with an update on the CFCI, which is Care First Community Investment, and 2022 planning for HICP. So get ready, we have a lot of fabulous presentations ahead. But first and foremost, we like to always start our mornings with an update from Jorge Orozco. So Jorge, welcome.
Hi, good morning. Welcome everyone. It really is a pleasure to be here. I can't believe the year's almost over. And I can't believe COVID is still around and with us. The good news is this week last year, we had about 150 patients with COVID who were very ill in our hospital. Today we have about 15. So that's a 10-fold decrease. So despite all the noise about COVID and new variants and so forth, we're actually in a pretty good place, a good place in terms of our ability to handle a COVID surge, but also in terms of the presence and the spread of disease in our community. So we're hoping that trend continues and we continue to go down. I know there's a lot of noise about the Omicron variant out there. At this point, no one knows anything. They just know there's a new variant, and variants continue to happen as long as people aren't vaccinated, as long as the disease is present and spreading in the community. So we don't know if it's more infectious. We don't know if it breaks through the vaccination. We don't know anything. So at this point, we're not necessarily very worried about it. We need to wait for the data to come through for us to take action. So I would encourage everyone to ignore the news reports until very clear guidance from our public health department or the CDC comes through. The hospital is full with other patients. We are challenged because we have a workforce challenge. We have many vacancies that we're trying to fill. In our nursing departments, we have reassigned staff who were not vaccinated, who were reassigned outside of clinical areas. So those two factors really have led us to be very tight in terms of our hospital. But despite that, we have been doing pretty well. I think our teams are working very hard and efficiently to move patients in and out of the hospital appropriately. And that has allowed us to be able to handle the incoming volumes. I did hear this week that last week we had our first few cases of influenza coming into our emergency department. So the flu, unlike last year, where the flu was really not present and spreading in the community, it looks like the flu is here and will be spreading through the community. So I'd encourage all of you to also get the flu shot, which is very helpful and effective in preventing the flu. So with that, I'll open it up to any questions that any of you might have.
Do we have any questions for Jorge about how things are going on the campus in general? You've given such a thorough update, Jorge. I wonder if there will be additional questions.
Well, you all know how to find me.
This is true. Well, thank you again. And like you say, I really appreciate how you started the conversation, which is, although it's still with us and it's still scary times, it's a much improved perspective from where we were a year ago.
Right.
And of course, we continue to vaccinate. The LAC USC vaccine clinic is open daily. It is vaccinating everyone from 5 on up, offering boosters as well. It's a great clinic. And I know this week we celebrated some of our youngest among us getting their second shots. So, kudos out to everyone who was the first in line with their kiddos 3 weeks ago and then got that second shot this week. So it's very exciting. But with that, I think we will let you go, Jorge. Thank you again for your update, as always. All right. So next up, we're very excited to have with us our friends Alicia Ramos and Iris Rain to talk with us a little bit about the campus projects, as well as the campus civic arts. So Alicia, are you ready to go?
I am. Good morning, Heather.
Excellent.
And I apologize, but I am getting this message that my Wi-Fi connection is not too strong, so I'm going to leave the camera off to make sure at least you can hear the message. So good morning to everybody. As Heather said, my name is Alicia Ramos, and I am with LA County Public Works. It's been a little while since we updated you on some of the campus projects, so I'm going to do that in the next few minutes. But also give you a heads up that it's not going to be a very elaborate presentation, because I think we have some really good information following here from Civic Arts. We want to make sure that we give probably the bulk of the time to the Civic Arts component, but we will be open for questions on both. So let's go ahead and get into the campus projects. If you would, Heather, thank you. So starting with our courtyard renovation and elevator addition project, what you have there on the screen, if you're following through the visual, is the conceptual image of what the elevator project will look like when it's complete. What you're probably seeing on campus right now, if you've been around the campus lately in the courtyard area, we've done all of our major demolition, which we're very happy to say we were able to get through that with minimal inconvenience. We had some concerns about the noise and vibration at some point, but we were able to complete that. So I think as far as demolition goes, the worst is behind us. and you'll start to see grading on campus, which means that we're basically grading out the area, preparing for the new foundations and the new support that'll be framed up eventually. So it will provide 2 elevator cabs, and we are looking for this project to be done. Next slide, Heather. It'll be done about July of 2022. And there's a visual of, again, the concept of what it will look like. So this is going to be around those spiral stairs that we currently have. The elevator would replace that. Okay, next slide, Heather. Okay, moving on to the Restorative Care Village project. So here's some images of our buildings. They are nearing completion. We're about 90% complete for the most part on the buildings. We basically have the hardscape, the sidewalks, the patios, the landscape, all of the Restorative Care Village campus still needs to be done. But this is a good image of what those buildings are starting to shape up as. And you can see on this one in particular, we've got the civic art component showing on that left wall, which Iris will give us more detail on that right after I'm done. So we are looking to complete this project at the end of the year. We will probably have some of what we call punch list items going into January. Next slide, Heather. So here's some other pictures of the buildings that are completing on campus, just to give you some sense of what they're looking like now. All right, next slide, Heather. Women's and children's demolition. So this is always the funny project for me because the progress we show just goes less and less, right? Since we're doing demolition activities. So what I've got there on the screen is sort of a visual of the different phases of RCV and those components. So in the orange, you'll see the Restorative Care Village, which I just covered. In the green, you'll see the Women's and Children's Hospital location, which we have demolished. And at this time, we're basically backfilling the graded area. And I'll show you a picture of that soon. And then across, what we would say maybe diagonal to us, and what we tend to call the triangular site, is the next phase of the demolition for Women's and Children's, which is a total of 4 buildings. We've demolished 3 of the 4. That 4th building is not demolished because it is the current childcare center, and that remaining building will be demolished once our new childcare center is up and able to receive the children. So demolition of the childcare center, we expect will probably start around May of this coming year in 2022. Next slide, Heather. Right, so here's some visuals of what that demolition site looks like now. So what you're seeing is the Women's and Children's site where we previously had the building. This is pretty much an open canvas now. We have had questions in the past about what might be used or what it might service in the meantime. The site will eventually become the next phase of the Restorative Care Village, which has components for mental health urgent care, mental health wellness center, potentially a psych inpatient tower, but that's still going to take some funding and time for that to come about. So there is an interim phase between what we have now and when those developments will happen. So there is discussion about what it might be used for in the meantime. As far as I know, right now, the idea is to have it available for some parking, since we know that the campus is always in need of parking, but there could be other ideas. Slide, Heather. This is the triangular site. So this is basically at that corner of Griffin and Mission. So we've demolished the 3 buildings. What you're not seeing in this image to the left would be the existing childcare center, which is still there. But this just gives you some idea of how we've started to clear the area for what will eventually be some permanent supportive housing developments. Next slide, Heather. And then our child care center, which I mentioned earlier. Once our new child care center is complete, then we will migrate the child care center, the existing child care center staff and children over, and that will allow us to demolish the existing child care center. So right now we've got all the utilities in for the new child care center. We've completed the foundations, the building pad. We're now working on what we would call the vertical construction, which is the framing. And we anticipate this will be done in spring of 2022. Okay, I think that wraps up the projects description. So I'd be happy to answer questions following the civic art component. So I'm going to go ahead and hand it over to Iris to take us through the civic art component.
Thank you so much, and good morning, everybody. I'm going to apologize in advance for the quality of my photos. I took them myself, and a lot of them were taken during the installation of the murals, which were a bunch of gray days, which was kind of merciful because it wasn't so hot for the people installing the tile, but doesn't make for glamorous photos. Next slide. So I'm just going to, in case someone isn't entirely aware of the project, I'm just going to sort of go through this a little bit. This is the site plan with Zonal Avenue on top. What you're seeing are 4 of the residential treatment program buildings, and they're called ABCD. And where you can see sort of the thick yellow lines, that's where the murals are. And just a reminder that what's very interesting, I think, about these projects is these projects is that we're dealing with multiple communities. So we're dealing with the community that's inside, the very vulnerable community that's inside the site. And then because A, B, and C are on Zonal Avenue, of course, anyone who's driving by, sort of the larger community. And this is kind of unusual for, this is a very unusual situation for the public art that we usually do, because usually where our mandate is to be the most public facing. And here we have multiple publics, right? And then there's, of course, the staff. So these artworks address the various communities, the various sort of interwoven communities in different ways. So just to remind you about the values and keywords: social justice, inclusivity, healing, environment, nature, welcoming, calm. These are words that the artists worked on that were created by you. Next page. Oh. And so here is the rendering you're probably familiar with the view from Zonal Avenue, and you can see the three murals in this rendering. And again, thematic priorities: the cultural, historical, past, present, future, connection to both General Hospital and campus, and also this idea of honoring everyday people. So not heroic, but really reaching out to viewers that will be using the site. And then cultural connections, indigenous roots, local community, immigration journeys, and other life experience of residents and patients, and this preference for narrative art. And residents meaning residents inside the facility, and then of course the larger community. Next page, please. And this image, I don't know if I've shown this before, but this is the architect's rendering from sort of the State Street area, kind of where those stairs are. And the reason I'm showing that is that we were able to add an additional mural on that building, the residential treatment program on the right. And you can see the recuperative care center on the left, which is the biggest building where residents of the village will actually live for a year, how that faces this interior building. And I'll talk more about that later. Next slide, please. So the first sort of the big welcoming mural that we see on Zonal Avenue is Lorenzo Hurtado Segovia. And I want to mention again how committed the artists were during this COVID time in terms of even just the fabrication process, where they actually found spaces where we could review the tiles and go through each tile, because we couldn't travel to the factories to go check out the tiles. So this is Lorenzo, who found a church gym in Glendale that had enough space and that lent it to him for free, where he could spread out the tile for our review. And each artist, I want to say, found strange spaces like this, like parking lots. And it's worth mentioning because I cannot impress upon you enough how much of a love and how much of a community effort this has been in sort of small ways that no one really knows about. Next slide. So here are some of the very gray photos on the left. The mural that's installed, during installation, and here when you drive by on Zonal, you'll be able to see it. Next slide, please. Next slide, please. Okay, so here I threw this in, even though it's a really terrible photo. You will have to drive by, but I just wanted to point out a couple of things. So on the murals, you will occasionally see, you'll see the little lines between the tiles, but occasionally you'll see a thicker line. Those thicker lines are score lines in the stucco that help it from cracking. And so those are lines that were upheld in the tile. And in terms of the tile installation, this actually was a lot of work to get all the spacing right. But in any case, if you drive by and you see sort of those larger lines in the murals, that's what those are. They need to be there so that things don't crack. With the smaller lines between the tiles, those get grouted. And this is something that you'll notice if you get close to the murals, but you'll get the overall vision from afar. Each artist chose sort of different colors of grout lines. So in Lorenzo's, there's actually some very complicated grout work coloring going on, so that, let's say in the realm of the tree, all his grout lines are specifically colored dark so that that tree remains sort of one entity. And then the grout lines are a different color on the rest of the mural. So that's, again, like a small thing that he worked on, which no one would know unless I'm telling you. So I'm telling you. And it is, yes, thank you for the question. It is graffiti. They're quite high up. Right now, the level of the ground is not where it's going to be in the end. It's going to be, the grading is going to be a little higher. You'll see where the bottom of the doorways are. However, even in the completed grading, these murals are 13 feet in the air. But yes, they're also graffiti treated. Thank you for that question. Next slide, please. So this is on residential treatment program B. So this is right behind Lorenzo's mural. This is the mural by Jamie Skolnick. And this is her during inspection. So we did big inspections where everything was laid out. Then when they got brought into on site, the tiles got brought on and installed. We had the conservator and myself and the artist after installation, and also Public Works and Canon, the design builder. We all went on the scaffolding. I have to confess, I didn't go on the very top one. That was a little much for me, but we looked at each tile to make sure there weren't scratches or cracks or, or any issues, and that the grout was done well. And so literally each tile has been inspected multiple times. Next slide, please. So these two photos, the left one is what you'll see when you start driving by, and then the one on the right is, when you're closer to the mural and you can see the whole thing. Since this mural is between buildings, you get sort of multiple views. Next slide, please. And this is what I wanted to talk about. That is another thing that you wouldn't know unless you were sort of inside the community. So Department of Mental Health and Health Services were very careful in telling us what kind of artworks, what kind of imagery would work for the residents. and also about the concern that artwork inside the buildings, even when it's attached with security hardware, and one needs to be very, very careful so that it can't be ripped off and maybe used as a weapon or just used in a way that could be dangerous. So what we're really excited about is in the windows of the buildings that are facing the artworks, the residents get to see the artwork through the windows. So it's almost as if they have artwork in their hallways at the end of hallways that go the length of the buildings. So it's almost as if they have artworks within the buildings, but not in a way that would be unsafe for them. And this is something that, anyway, that you wouldn't know unless you did a tour inside the buildings, unless you got inside the buildings. And so we're very happy about that because it really activates the spaces for the residents in a way that makes it sort of more home-like. Next slide, please. The furthest artwork on Zonal Avenue is by Patrick Martinez. And again, on the left is an image, the first image you would see if you're coming from Mission driving by, and then you'll see the full artwork on the right when you're closer. Next slide. So here again, and this is Patrick Martinez himself, you can see what the residents will see. I think this is taken on the second floor, but you also see, you can see the artwork from the second and the third floor. And I wanted to note something in particular to tell you how thoughtful the artists were about their work. On the left-hand side, so closer to Zonal, is the quinceañera dress. And on the right-hand side, which is more what the residents will see, let's say if they're in the park-like courtyard of the residential facilities, is the more neutral bouquet. And the reason Patrick did this is because he was thinking that for some residents, the quinceañera dress might be triggering. It might bring up some images. So he put that on the more sort of public facing side. And then the side that's more internal to the campus will be more, you know, flowers that, that you helped him source from the community. Next slide. So this is the mural by Star Montana, which is this layered photograph of Boyle Heights and then and City Terrace, and then the city of Los Angeles behind. This is the mural that you can see it from Zonal, sort of obliquely, but it's, when you get there, you'll see there's something very calming about the colors, and it's meant mainly, or the primary view is actually from the inside of this campus, and then also from the residential community where people are going to be living for a year. Next slide, please. And this is Star Montana, the artist, and the window here is actually from one of the bedrooms within the recuperative care center. Next slide, please. And this is what I'm just so incredibly pleased by, that this worked out in the way it did. Is we thought of how the residents in that facility, they actually have a view of General Hospital. And here you can see how the image of General Hospital, or the fact of General Hospital, and the image of the community and the city of Los Angeles, how they get seen together. This all becomes one sort of larger image in one community. This is also taken from a bedroom in the recuperative care center. Next slide, please. And this image, I thought, sort of explains a little bit how it comes full circle. This is an image, this is a photo taken also from the Recuperative Care Center, from the multi-purpose room where everyone will hang out. So they can both see Star Montana's mural and then also the Lorenzo's mural, which of course is showing the 100-year-old tree from the Child Care Center. So it's like the beginning and then sort of the layers of the community and General Hospital. And so they get the full picture of everything. Anyway, so thank you so much. I would encourage you to drive by on Zonal, maybe not during the week since there's construction and you don't want to be caught in the driving in and out, but there, for anyone who hasn't been there, there are a couple of spaces on Zonal that are metered spaces where people could park and you could sort of walk and see the murals through the construction fence. And also a really good view is if you go across the street where that parking lot is and just sort of walk up and down the sidewalk, you can see them yourself. Anyway, thank you so much. And please feel free to ask questions.
We have a question. Yeah, we have one question in the chat, Iris. It's from Ari. Will the doors stay that gray color or will they match the wall color?
That is more of a question for Alicia.
You're right. Okay. A great question. Thank you so much for that. These are the little details that we're still left to do on the project. So that gray color will be painted over. So right now you're just seeing sort of the unfinished product. And as Iris had mentioned earlier, along those facades, there's also some grading and some ramps that get put in that area too. So it's still incomplete in that area, but you'll see some changes on that. Thank you for the question, Ari.
Any other questions for our wonderful Civic Arts and Public Works team? Well, thank you all so much. It's looking absolutely beautiful. And it's very interesting, of course, to see the perspective from the residents within the facilities. It's really interesting to see their point of view. I think we have a question from Ari.
Yeah, so I think it's a great recap. Thank you so much. Great to see it coming along. What I'm wondering is how can we hear more from the artists? And will they be invited to the opening? Will there be a separate opening for the art versus the facility? And also, you know, just being able to promote and highlight the pieces and the artist, I think is what I'm hoping that we have a plan for. Is that so?
So appreciate that question, and I so appreciate the collaboration that you've all had with the artists and with us. I'm not sure we know the answer about dedication. We call it dedication of the campus yet. Alicia might know more, but I think given sort of health reasons and all that, I think that's definitely being thought of as something that if it's going to happen, it'll happen, you know, next year sometime.
So let me say, if I could,
yeah.
Iris, we
Yeah,
don't
absolutely.
have a date. We don't have a date specific identified yet. Obviously, there's a lot of, I think, excitement over the completion of all of these campuses, particularly the LAC USC campus. We've already had a number of visits, even though we are still yet to finish completely. I know there's a lot of interest, not just from the local community and from Supervisor Solis's district, but also through the state, also through the country. These restorative care villages really are these new building types, these new facilities that are addressing an issue that is not just here in, you know, our local communities, but it's facing the whole country: mental health, homelessness, the medical health issues that so many people face when they don't have the care network at home to complete their recovery. So I'm saying this because while there is not a date identified yet for the opening, there is a lot of enthusiasm and a lot of interest that we're going to see across all platforms that are going to want to come and see this facility, whether it be in one opening event, which I think, and I cross my fingers, that numbers stay good relative to COVID and that we can gather in person in larger numbers. But I think you're still going to see other people, other entities, organizations visiting this site, wanting to hear about this site in these initial months and probably the first year of operation. So I put that out there as consideration that I think we'll have several opportunities. My hope also, I think, Ari, what you mentioned about how do we hear more from the artists, you know, just as my own personal kind of input here, I would love to see something that can be maybe even as simple as brochures that we can have at the center, so that when you come there, there's something specific on the art itself. Maybe it features the artist with their work and a small excerpt of, you know, what inspired them. But maybe something like that is the idea we can start to, you know, put roots to and see where it can go.
Oh yeah, well, I'm envisioning postcards and T-shirts and things like that. And you know, I want to be able to have that art, you know, posted in my office or, you know, that sort of thing, so that the community can enjoy it more. But I think educating folks about the meaning of it and really just the process as well. I mean, you know, one thing is to have the art up, but it's also to give the artist a platform. You know, I think that's really more my suggestion.
Yeah, no, thank you so much for the comments, Ari, because these are really the starting points for how to take it to the next step. And I just want to echo what Iris is saying about all the hard work the artists did, but I also want to reflect that back to the community. Just this group in particular with HICP, it's something that when we come to the end, all that work is behind us, but it really does culminate to such a rich project from all different aspects. And I thank everyone who took part in it.
I just wanted to, say a couple of things. One is we will have, like, part of what Civic Art does is we do these things called fact sheets. So they're sort of descriptions of the artwork, and we laminate them and we leave them in the facilities, and we can also, you know, provide that kind of, so that's sort of part of things. The plaques on these, which are not yet installed, are more narrative than usual, so that it's not just like the title of the piece, but a little description, and they're in translation. And we're working on also sort of a larger community plaque that will be situated on zonal avenues, so that somebody walking by will also be able to read about the art. But one thing we've been batting around, and I'd actually love feedback on this, like if this is the kind of thing that seems interesting, is that maybe we could bring the artists together to have some sort of a panel. Is that the kind of thing that seems interesting? Or Ari, were you thinking more, I don't know, like guided tours or like in person? Or do you have any or anybody, does anybody have any specific feedback on, let's say, the panel idea?
Well, I would think that the panel idea, I mean, you may have the whole artist community may address it in a different way, but then somehow what I want to be able to do is promote the artists, you know, and their work and their vision, and the fact that it's part of a government infrastructure project. And, you know, and of course, it also gives it an opportunity to talk about the sensibilities of the type of art that can go in a space that's of what it's going to be used for. So it's an education tool as well. So anyway, I think, you know, a story, a video, an introduction to the artist, you know, a profile of the artist would be a great thing to be able to do. I mean, nowadays we have websites and social media that we can help promote in that way as well. So maybe it's more of a produced piece rather than a, you know, press conference and then that's it, you know?
Yeah. I love the idea of a video. Yeah. Well, this is very useful feedback for us, because we are actually right in the, you know, we're all trying to figure out what COVID means and how to open and how not to, right? Like to do everything right. But this is sort of an additional piece that could, we could, you know, start formulating no matter what. So that's the kind of, it's very interesting information. I don't, if anybody has any ideas or desires along those lines, they should definitely feel free to email me, because this is exactly the kind of thing that we're trying to figure out right now for the future next steps.
Hi, everybody. This is Betty.
Hi, Betty.
Just want to, hi there. I just want to echo and totally thank Ari for the suggestion. I think it is important to highlight the artists themselves. You know, for Star Montana, it's such a huge sort of full circle life experience for her to have the mural at the hospital on the campus. I mean, there's really such important points to bring forward that I think like the video highlighting or some way to some tool that then we can share out as well within our organizations and the communities that we serve, I think will be such a great way to share about the artists in the interim, since we can't do anything in person right away. Thank you so much for that, Ari.
Yeah, thank you.
And hi, Iris and everyone. This is Rosa.
Hi, Rosa.
Just wanted to thank you guys for the incredible efforts that Civic Arts and our Public Works Department went through to ensure that there was true engagement with our community through the Health Innovation Community Partnership at every step of this effort. I would think that we want to continue to invite ideas like this, now that they're up, now that there's, more of that tangible connection, right, that we start to learn from our HICP leaders, from our community. How do we ensure that we do a good job with unveiling this, with making that connection? I was thinking about that wonderful conversation we had around art, but specifically muralism and that connection, for Boyle Heights and for East LA. So just want to make sure that we, can really absorb the richness of the discussion and be able to then come back with some ideas, that maybe we hadn't thought of before. And I realize that sometimes that may also mean, time, effort, budget, but I feel like, at least from the conceptual standpoint, it would be great to continue the discussion. So whether it's through the chat today, like you said, through emailing us, just continue to send those ideas through. Thanks so much, everyone.
Yeah, actually, this is making me think, and I love your feedback even on this, is definitely email me, but should, Civic Art could host a meeting around this. I know it's more, it would be more time on HICP, on the members' time, but maybe I'd be happy to do that, right? To have a conversation around that. Is everyone feeling like it's too many meetings, overwhelmed, or is everyone liking that idea? Because that's something that we would definitely appreciate, having that kind of input in no matter, in any kind of form.
I would say certainly for HICP, it would be delighted to host a special panel presentation with the artists. We could record it and that, through Zoom, and then create a video that could be used afterwards. And I think we could reconvene the committee to maybe provide some guidance on messaging and other ways of doing kind of community-based messaging. I think it is a wonderful opportunity to promote, the public-private partnership, also that community inclusion and that cultural kind of celebration really of this facility. So I think there's so many great ideas shared here. I'm confident we can dig in on a lot of them. Yeah. But like I say, I would definitely be very happy to, we could host a special HICP session, maybe in the evening, to attract more community participation with the artists. And then, like I say, record that and then create a short video, have the entirety of the presentation out, but also create maybe a short video with clips that could be kind of more broadly promoted. But I'm sure we could support you with that.
Okay, this is all very fantastic. Yeah.
Right, and also leveraging the county's TV channel, all that media opportunity that it brings.
Great point too, Ari, to make sure. That's actually one of our recommendations for the entire HICP medium, which we'll talk about a little bit later. With this, I'm so delighted to thank Alicia, thank Iris, thank everyone on HICP who's participated in this process. It's so beautiful to see such a wonderful community asset come to life and come to beautiful life at that. But I will keep us moving along in our presentation as we have many other presentations to get to today. Before we do so, however, Monica, our Spanish translator, would you please reach out to Sophia? It seems like there's an issue with our Spanish language channel, so hopefully you and Sophia could resolve that. If Monica would reach out to Sophia, that would be much appreciated. Thank you again, everyone, for the great commentary and feedback on our public arts project. Next up, I'm delighted to welcome Erica Gutierrez from the Department of Regional Planning, who will be sharing with us the LA County Metro Area Plan update. Welcome, Erica. You are muted, Erica.
Okay, thank you so much for having me. And yes, I think you have my presentation. Okay, so again, it's a pleasure to be here. I was here about 2 months ago, maybe, and we had just started the process. So I'm here to provide an update on, what we've done so far. So next slide, yes. Okay, and I'm just going to give an overview again. So because I think, people might still not fully, maybe comprehend what the plan is about. It's a big one. So it's basically the Metro Area Plan, and it's covering one of the 11 planning areas that was set up by the General Plan Framework in 2015, and it's highlighted on this slide. It's basically covers the center of Los Angeles County. And there are actually 7 communities within the Metro Area Plan that we cover, and those are the unincorporated communities. So you can see these here throughout the metro area. I'm just going to go through each of them quickly. East Los Angeles is the first one, and that's actually the largest one. And you can actually go to the next slide. Great, thank you. And so we just have a little bit of stats on Los Angeles. Again, it's the most populous one, and it's one of the ones that we're focusing on very closely as well. And the next one of the next communities are Florence Firestone. Florence Firestone, we actually do have an ongoing transit-oriented development specific plan. But we will be looking at prior sort of plans as well in Florence Firestone Community Standards Districts, and the same for East Los Angeles, and I'll go into that a little bit more later. Walnut Park, which is a mostly residential, small neighborhood within the county. East Rancho Dominguez, which at this point doesn't have any type of community plan. So we're very excited that it's going to be part of the Metro Area Plan. Willowbrook, which also has quite a bit of history. And so it is also part of this plan. And then West Rancho Dominguez, which is predominantly industrial, but also has some residential there.
Estamos allá en la clínica, pero me mandó por unas copias.
And
Está allá en la clínica.
Oh, sorry. Okay. And then West Athens, Westmont is the last of the communities, I believe.
Sorry about that, Erica.
Oh, no problem. Okay, so those are just the 7 communities that we are covering. They're all a little bit different. And then here's a slide where it shows, the existing plans and regulations. And so, as I mentioned before, East Los Angeles has 3 different kind of regulatory overlays, and it's the East Los Angeles Community Plan from 1988, the 3rd Street Pacific Plan from 2014, and then there's the Community Standards District. And so we are actually kind of going in to all of these communities to see what we can update as a part of this process. The 1988 plan, for example, has not been updated since 1988. And then, as I mentioned, Florence Firestone, we did actually have just recently the Florence Firestone Community Plan. So in this case, this is something that we will not necessarily, update very much. but we're looking at all of it. And part of the metro area is not to just take away all these plans, but rather to sort of
Parte de la zona de Met.
sorry, so to go in there and kind of see where we can improve what's existing, and then, you know, add new things. Okay, so, and then as you can see, there's other plans that we'll also be kind of touching on. So that's one thing that the plan does. It's going to update existing policies and regulations. It's also very highly focused on equity and environmental justice. So we hope to kind of improve on some of the work we've already done with our Green Zones program in these communities. Also, it's implementing the housing element update. So there will be some proposed rezoning as part of this plan. And through this plan, we will be able to actually do the rezoning that is proposed through the housing element update. And then we're also looking at other things. We've partnered, I mean, we were collaborating with the Department of Public Health on their pedestrian planning, and we're looking at other ways that we can promote, you know, safe streets and multimodal transportation. And we are also looking at other things like economic development, you know, green space, community identity. A major effort that we're starting to work on right now is a historic context statement. And that's not on this slide here, but it's basically going to be kind of an entry point into the, you know, the historic context of these communities. And we will also be doing a historic survey for Florence Firestone. So we got special funding for that, and it's also going to be kind of bundled into this metro area plan. So it's a comprehensive plan, and it's got a lot of moving parts. And you know, at this point, we just finished the first phase of our community outreach. So I think that might be the next slide. Yeah, so this is kind of this is the project schedule. And so round one workshops, we just finished. I'll give a little bit more information about the attendance that we had. And as I mentioned, right now we're in the process of doing some background reports and historic research. We hope to have that done by the end of the year or the beginning of January, and that will include the historic context statements, as well as a variety of other technical reports. Then we plan to have some draft scenarios prepared for the plan, prepared in early 2022. And that's also when we'll release the notice of preparation for the environmental impact report. And then we'll have first draft plans and maps available for public review in, you know, about the spring of 2022. And that's also when we'll start the next round of outreach so that people can comment on the actual draft plans. So then and that's kind of, those are the main elements of, you know, what's coming up in the plan. There will obviously be the RPC hearing at the end of 2022, and then the actual approval by the board, we plan that for 2023, or adoption by the board. So just to kind of outline our outreach efforts, we are doing virtual and in-person community outreach in 2 major phases. I just mentioned we completed the first phase, which was mostly in person, but we did partner up with the Department of Public Health on their step-by-step pedestrian planning, and attended some outreach in certain parks throughout these communities. We have also formed a community advisory committee, and there's been a lot of interest in this committee. We've met once so far. We plan to meet about, I think, 6 or 7 more times. And we are hoping to set the next meeting up within the next 2 weeks or so. And the Community Advisory Committee is made up of members who basically live in the communities of the metro area plan. We are also collaborating with the Los Angeles County Library System. We have a kind of a passive way of collecting outreach, what we're calling map stations at the libraries. We're working to set those up. We set one up with City of Terrace. And again, this is another way to collect feedback from the community. And then we're collaborating with community-based organizations on the project, which is a new approach that that we're taking, you know, in the department, and that we kind of did a little bit with some other programs, but we're kind of trying to do that more. We've also, you know, through this process, community-based organizations have also been reaching out to us. For example, recently LA Walks reached out to us, and they are working with the Willowbrook Inclusion Network, as well as with community members in West Rancho Dominguez, and we are working with them to have a special workshop sometime in February of next year, focused on, capacity building with their community members. And we're also seeking opportunities for outreach with local schools. We are working with one school in particular in East Los Angeles. It's called the East Los Angeles Renaissance Academy, and trying to set virtual outreach or workshop up with them. And again, we're also looking for opportunities to do more outreach at local schools to involve, a variety of constituents of all ages, including youth. Okay, and I just wanted to give a little bit more information on, the outreach we've done so far. And this kind of shows you how many people attended the workshops. These were all the virtual workshops. So we had, generally speaking, around 25 attendees per workshop. The attendance for Willowbrook, East Rancho Dominguez, West Rancho Dominguez, and West Athens was a little bit lower. And that's why we're actually excited to bring in other groups such as LA Walks, who represent Willowbrook and West Rancho Dominguez, for example. But we did have very high attendance from East Los Angeles, and also from Florence Firestone, and Walnut Park was more highly attended. So far, the last time I checked, which was earlier this week, we had about 63 respondents to the survey. So obviously we're trying to continue to promote the survey and get more respondents. And then we also have our website, which we're directing people for more information. Thank you. And then this is just some of the information on the attendance at the parks. And we had, again, a pretty good attendance at the Willowbrook one, a little bit less in East Los Angeles and Florence Firestone. And we're having another workshop tomorrow that my supervisor, Pat, will be attending that at the East Rancho Dominguez Park. And then we will have another last virtual outreach session, which is actually being hosted by Public Health next Thursday, December 9th. And this is just a picture of the station that we set up with City Terrace. And as I said, we are working, City Terrace Library, we are working to set something similar up like this with the other county libraries. And we're pretty excited about this. This is also kind of a new approach that we're taking. And we hope to have this kind of collaboration with the library system throughout the kind of life, the timeline of the project. So that's, through 2023, and kind of seeing how this evolves in terms of collecting community information, distributing information, and so forth. And that's it for my presentation. I just wanted to give a quick outreach. I think the most of the outreach that we had, it was basically on, the outreach that, most of the updates that we had was basically on the outreach that we've done. I think one thing I forgot to mention as well is that we have also formed a technical advisory committee, and we have been working with our partners in the county, including, for example, the Department of Public I mentioned public health a couple times, but also, civic arts and the Department of Parks and Rec and Public Works as well. So anyway, in the Metro Area Plan team, if you have any questions, my name is Erica Gutierrez. I'm a member of the Metro Area Plan team, and I'm happy to answer any questions. Thank you.
Thank you so much, Erica, for joining us today for the update. I really love the interactive displays you have at local libraries. That's a very cool idea. Does anyone have questions for Erica?
Guadalupe asked if Erica could share who your consultants are as well.
Sure. Our consultant is JUDEC, and they have various sub-consultants as well for parts of the kind of the artwork and also the outreach. So Rostin Wu is an artist that's helping us work on various aspects of the project. I believe also on the historic context statement. And he also helped design the logo and some of the other kind of images that we're using for the project, to promote the project. And then James Rojas is, you know, he's helping us do some of the outreach as well. And he was very involved with the virtual outreach. And I'm trying to think, there are other sub-consultants that we're working on for things like the economic development reports and other kind of reports that DUDEC is compiling.
Any other questions for Erica? I think I see you ready. I think I see you primed, Greg. Go for it.
Yeah. I'll try to be brief because I know there's a lot in this plan, and you highlighted many potential engagement opportunities. So thanks for doing that. I kind of wanted to just ask for a little more information on the rezoning piece that you identified. I was really pleased to see that analyzing preventing displacement is a top priority there, and I think that's a priority that community groups would definitely share. I know that they're part of this is meeting state law requirements that do require the county to increase its zoning capacity, and that are sort of outlined in the housing element. Just at a high level, to the extent that the housing capacity is going to be increased in East LA, will that primarily be done through a sort of value capture mechanism? So in addition to preventing displacement, when that zoning goes up, is it going to be asking developers to also be providing community benefits? Or is it primarily going to just be increasing the base zoning with additional incentives available on top of that? If that makes sense. I guess I think I'm hoping that capacity could be extended through value capture rather than just increasing the base zoning.
Yes, thank you. So I think that, I guess to answer your question,
Sí, gracias.
the housing element update was just approved, and I don't have the specifics about the rezoning that's proposed, but I do know that there is some rezoning proposed throughout, I believe, most of these communities, and that was based on, objective data that was pulled, and as you said, it's state mandated. I do know that there will be there's a new kind
Yo
of.
sé que va a haber una.
Let me see. Sorry, there's a new
Perdón.
Base land use.
Creo que hay
so it's
un
going to
nuevo
raise the
uso
base
de la
land use.
tierra.
I'm so sorry, Erica, if I can interrupt for a moment. Monica, for some reason, your translation is coming through into the main room.
I am so sorry. I am just trying to follow directions that are given to me. They're telling me to speak on the Spanish channel, and there is no such Spanish channel. So I already joined the new link and everything I was told to do, and I've been told to speak now, but I knew this was going to happen. I just don't know how to resolve it on my end.
No, I don't know that it is something you can resolve, Monica. I'm so sorry. It's part of the original structure. So
I apologize to the presenter. I'm so sorry to interrupt. I was just trying to do what I was being told to do. So
yeah, absolutely.
I'm sorry for the interruption.
Yes, so I guess from what I can tell, it looks like for whatever reason our Spanish language channel is not working properly today. So I'm afraid we may not have simultaneous translation today. I sincerely apologize to the group. Obviously, that is not the way we like to run our meetings. But I think, unfortunately, to reset, we have to restart the entire session, and we would lose everyone. So
Heather, if you will excuse me for 1 minute, I just got the welcome for interpreter. So let me try it now.
Okay, perfect. Thank you.
All right. Yes, thank you. Sorry again for the interruption.
It's quite all right. Technical difficulties do happen. All right, Erica, I'll turn it back over to you.
Okay, great. And I was just in the middle of answering the question. So So as I said, the land use designations will be raised higher than they, or, higher than they've been before. And that's, I believe, countywide. But I don't have the specifics about the rezoning. That's something that we know that, people definitely want to see. And so we are working on that. That's going to be part of what we kind of unveil and have more information on for the next round of the outreach and, the next round of draft materials. But yes, we are looking at how we can possibly incorporate community benefits as part of this rezoning. And as you mentioned as well, we are definitely looking at using different tools to look at, displacement, and anti-displacement kind of strategies as well as part of this rezoning. So I hope that kind of answers your question, but basically in a nutshell it is that we are looking at things like that, and that we'll have more information a little bit further along in our process.
Thanks. Thank you.
Thank you. I see a comment here from Guadalupe, and your hand is raised. Guadalupe, do you have a question you'd like to ask?
No, I just wanted to emphasize that, speaking to Greg's question, yes, we've had conversations with Connie and, who's overseeing also at the top on this effort. And we are very much interested in the value capture to provide community benefits, as we are looking at the rezoning as part of the housing element. And so that is definitely an item, Greg, and so we are very interested in that.
Great. Do we have any other final questions about the metro area plan? Well, thank you again for the update and kind of continuously coming back to keep us up to speed on the happenings and what's going on. Definitely exciting to see the next steps coming in 2022 and 2023. So thank you very much for joining us today, Erica.
Great, thank you very much.
All right. Next up, we have our primary presentation today is going to be speaking about guaranteed income programs. I'm delighted that we will have speakers from 3 different agencies represented today. We will start with Carrie Miller from the LA County CEO's office, and then we will hear from our LA County Department of Public and Social Services, and then finally conclude with the City of Los Angeles. So with that, I will ask Ms. Carrie to give us an update on the Poverty Alleviation Initiative. Welcome, Carrie.
Hi, everyone. Thank you so much for having me. I really appreciate it. Great to be here. I actually had 2 things I wanted to talk about. I will start with the Guaranteed Income Program, since that's what's up on tap here. Los Angeles County is in the process of launching a Guaranteed Income Program. It's called Breathe LA County, and it will launch sometime in early 2022. We're hoping first quarter is what we're aiming for. And in this program, we will be offering 1,000 LA County residents $1,000 a month for 3 years. It'll be unconditional cash, like most traditional guaranteed income programs. And we're really excited about this. We see this as a really important opportunity, not only to help people and, test out this concept really of guaranteed income and what does it mean and how does it help people in short and longer term. And so we are partnering with University of Pennsylvania to add a research component to this. And so the process will be that we will provide this income, we'll collect baseline data, and there'll be surveys that happen every 6 months with participants, and we will have a control study, a control group with this, so that we can really figure out over a 3-year period, how did this impact folks' lives? And the question really is, does it make a difference just from an economic standpoint? Does it also affect well-being, which is what some early research, and certainly for those who've watched the Stockton project, there's early research to show that there are positive impacts on well-being as well. And so that's what we're really interested in taking a look at. So more to come on that. We will, when we have our information ready about our open enrollment process, we will make sure to share that so that the word can get out the word can get out, and we certainly welcome it and ask for your help and your support in getting the word out, so folks know that it's out there and that they can apply. I see a question here in the chat. Is it all LA County or specific to or unincorporated? That's a great question. Our program is targeted for all of LA County, not just unincorporated, although unincorporated certainly is included in that. And what we're looking at is, though, I say all LA County, but with a caveat. One of the things that we're looking at is targeting specific neighborhoods in the county that we know were particularly hard hit by the COVID pandemic, and that also tend to be more under-resourced and marginalized. So we're looking at about, we will identify what that looks like, but it's really census tracts that fall at or below AMI, which really covers almost half the county. So when I say it's covering a lot of the county, it's about half of it. So all neighborhoods who would fall in that category, residents of those neighborhoods are eligible to apply. I did have one other thing I wanted to give a shout out on real quick, but before I do that, are there any questions about that? Okay, then the other thing I just want to present on briefly, and it's an ask to the folks in this room, is that not only as part of this poverty and alleviation initiative are we launching this program, we also are in the process of drafting a countywide strategic plan on alleviating poverty. And to that end, one of the things that I'm doing is holding listening sessions all across LA County. I've spoken already to about 400 different residents from all walks of the county. I'm starting to talk to community-based organizations and advocates and policy wonks who work in this space, because I want to hear their perspective as well as I will be canvassing county employees to get their perspective. And in this process, I'm really interested in talking to anyone who's interested in talking to me about how do we alleviate poverty? What does that look like? What should we be focusing on? Do people have ideas or thoughts? What's worked? What hasn't worked? I'm interested in hearing it all, and I'm interested in talking to anyone who wants to talk to me about this. I'm trying to, if possible, wrap up my listening sessions by end of January so that I can then start putting together a draft plan. And anyone who does participate in a listening session, I will share the draft with you so that you can help vet it to decide if you like it, if you don't, what kind of changes would you want before it ends up being submitted to the board. So this is my appeal to everyone on this call. If you're interested in talking to me, hosting me with a group of folks, connecting me to clients of yours or folks you work with or any kind of network, or just you yourself want to talk to me, I'm open to all of it. I'm going to put my email in the chat, and I would say, please reach out to me. And I'd be very interested in talking to anyone who's interested in that.
Thank you so much, Carrie. And I know we'll be delighted to welcome you back to hear more about the programs and your report back from your findings of these listening sessions. Does anyone have any questions for Carrie about the CEO's efforts related to the poverty alleviation listening sessions or the Guaranteed Basic Income Program for LA County? Obviously more to come on that as the program launches next year. We do have a comment here for you in the chat, Carrie, about an offer to pull together an outreach and input session for the LGBTQ community. If you're interested, Ari Gutierrez would. Yes. I think she's interested, Ari. I think she's accepting your invitation.
I'm going to take your information down, but I just put my information in the chat. Let's connect. That would be wonderful.
Do you have any specifics on qualifications for the Guaranteed Basic Income Program at this time, Carrie?
What we know is that we're looking at folks who live in one of these neighborhoods that I mentioned. And then other than that, no, just that they need to be a resident of LA County, obviously living in one of these neighborhoods, above the age of 18. And we did just put an income cap of either at or below AMI for a one-person household or 120% of AMI for a two-person or more household. And other than that, no, except as you're going to hear, there's 2 other programs. There's actually more, but there's at least 2 other programs in LA County. So we did also say we don't want people double dipping. So if you're a participant in one of those, then you're not eligible to participate in ours.
Thank you so much, Carrie. And I also want to make mention, Aiden Pasabani from Supervisor Solis's office is put a link in the chat where you can sign up for a listening session with Carrie Miller. And I just also want to recognize Aiden for helping us bring this fabulous panel together and for his collaborative efforts to kind of bring this program to our table. With that, thank you so much, Carrie. We will move along in our presentation. I'm delighted to welcome LaShonda and Sean from DPSS to talk about the Taypertunity program. Oops.
Great. Oh.
Wait, I think I'm in the wrong. My apologies.
Yeah.
I'm going to go to Taypertunity.
That's okay. There we go.
Got him in the wrong order. My apologies.
Good morning, everyone. I'm LaShonda Diggs. I'm the chief over our GR and CalFresh division at LA County DPSS. I'm here this morning with Sean Amell, who is our Grow Program Director. So we are very delighted to be here and excited to share with you what we're doing in the area of guaranteed income for our participants. So Sean will walk you through our program and we'll be happy to answer any questions when she's done.
Great. Good morning, everybody. So I wanted to give you a little background as to who our population is in our Taypertunity and GI program. So for those who may not know, GROW is basically a subset of the General Relief Program. So the General Relief Program is a welfare program that offers $221 per month for those individuals that are adults without dependents. And if those individuals are considered employable, then they are enrolled in our Welfare to Work program that we call the General Relief Opportunities for Work, or better known as GROW. And when someone is enrolled in our GROW program, they are offered various opportunities, activities, both educational, training, subsidized employment, to help improve their opportunity to gain gainful employment. And they are in this program for a period of 9 months. So we created a program called Taypertunity. So Taypertunity is a play on words of our Tays that are 18 to 24 years old, and we wanted to give them new and specialized opportunities. So in our Taypertunity program, we outreach to our GROW participants that are 18 to 24 years old, and we wanted to offer 3 new pathways that we hadn't previously provided, and that is apprenticeship opportunities. Pre-apprenticeship and full apprenticeships in some labor markets such as aerospace, biomedical, as well as construction. So they can be learning while on the job and get them prepared for employment in those fields. We also had a lot of good feedback from our customers that they really wanted to become their own boss. They wanted to have their own business, but didn't know where to begin. So we created an entrepreneurship pathway with a partner that basically for a period of 9 months really gets them informed and educated on how to get a business license, how to develop your product, how to market your product, so that they have somewhere to start with when they're creating their new business. And we also offer subsidized employment. And this subsidized employment is in a variety of fields that they are interested in getting this employment. And we subsidize employment for 6 months for 40 hours a week, and they're earning minimum wage. So in addition to them getting these career paths, they are assigned a case manager that really is giving them really intensive case management, working with them once a week, checking in, see if there's any barriers that have come up that we can help them overcome, see how they're settling into their career path, and just basically motivate them and encouraging them. With any additional ancillary supports that they might need, such as supplies, equipment, transportation funds, that's all offered as part of this program. So we set up this structure of Taypertunity, and we wanted to facilitate the DPSS Guaranteed Income Demonstration Project within Taypertunity. So 150 GROW Tays, 18 to 24, we're being selected for this GI project. And if they are selected for the GR project, they're going to be receiving all the services I mentioned for 36 months. In addition to benefits counseling, we really want them to know when they're getting this money, how to use it, how to save it, as well as additional information on how to improve their credit, how to build credit, how to think of their money for retirement. And we really wanted them to really be informed about how this money is going to be changing their lives. So what is our guaranteed program looking like? Well, we are selecting 150 Ks, and we were able to get board approval to waive some of the general relief program requirements. So what does that mean? Well, we're not going to count their income. That means that if they start getting a job, in addition to receiving their GR and in addition to receiving their their guaranteed income, it's not going to be counted against them. So it helps them to kind of increase their earning levels, as well as the resources. If they want to save this money, we will not be counting that savings against them, as well as time limits. So as I had previously mentioned, people that are in GROW are on the GROW program for 9 months. So because our GI program is for 36 months, they will be receiving general relief, their GI income for a full 36 months without interruption. So what are the total amounts that these GI TAs are going to be getting? They're going to get their $221 per month in general relief. They're going to get their $1,000 in guaranteed income. And if they're getting CalFresh, they're going to be getting their CalFresh benefit. Now, because we weren't able to get a waiver for CalFresh, that GI money and their GR money will be counted against their CalFresh benefit. But because we don't want to penalize them for it, we are going to be giving them a food supplemental assistance benefit to bring them up to par to what they were getting, so that they will not have any negative impact to their food benefits. So no matter their income, no matter their resource and how long they are on GR, their GR case and GI benefits will not terminate. The only time it will is if they become incarcerated, if they ended up moving out of state, out of the county, if they request to be terminated, and if they become deceased. So we began recruiting for GI in September 2021. However, we're going to be revising our process to randomly select TAs in a different manner. We began issuing the first GI benefits on October 1st, 2021. So as of, I think, mid-November, we have 39 youth receiving GI. And I think I received the most current numbers yesterday. Now, actually, we now have 55 youth receiving GI in our program. So we've been asking periodically our youth, what are they using this GI money for? Some have said they're using to supplement even more their food and groceries, buying clothing. Some said educational tools for school, and even for a new business. They've increased their rent and housing expenses and moved to better locations. Some said they moved to new housing and they had to buy furniture. Some said hygiene products. And we were surprised to say some are saving to buy a car or savings for a future business. We have a lot of clothing designers in our program as well. So that was always good to hear. So we are going to also be partnering with a research partner. We're looking for a research partner to start looking at the effects of GI, how it's impacted the lives of these youth and how it helps them gain employment. So they have been aware of working with the research partner when we bring them on board, and they are ready to prepare to share their stories of how GI has impacted their lives. So that's a brief overview of our current GI program here at DPSS.
Thank you so much, LaShonda and Sean. Do we have questions for our colleagues at DPSS about the Tapertunity program? It sounds like you mentioned you have 55 enrollees at this time, but my understanding is your target is 150. Does that mean you're still actively recruiting, or do you have your process identified separately?
So as I mentioned, we had our process, but we're in the process of revising. So we're pausing right now. We're going to revise our outreach methods to make it a bit more random selections. So we're pausing at this time, but we're ready to get started as soon as we possibly can.
Great. That sounds wonderful. Well, I can't wait to hear back the results from your research partners after you hear more about how this is impacting and benefiting people's lives. We do have a question in the chat about undocumented individuals or dreamers being able to participate in this program.
So they have to be part. Oh, so I'm sorry, LaShonda, did you want to take that question?
Oh yeah, that's fine. So as Sean mentioned, individuals in this program have to qualify for general relief. So right now, undocumented individuals do not qualify for general relief, therefore will not be eligible for the guaranteed income. However, on GR, we do provide aid to qualified immigrants. So I'll have to look particularly about the dreamer status to see if that's one classification that we aid on GR. So I'll get back to you on that piece.
This is Carrie. If I may jump in on our program, the Breathe LA County that I mentioned, undocumented are eligible to apply.
Thank you, Carrie. Additional questions for our fantastic presenters today? Okay, well, we have one more presentation to go in this same category. As I mentioned, I will now hopefully somewhat speedily return to the Big Leap program. We're very excited to welcome our colleagues from LA City, including Celeste, Veronica, and Aaron, to discuss with us the basic income program that LA City is launching.
Thank you so much, Heather. Can everyone see and hear me?
We hear you fine, Aaron.
Okay, great. Hi, everyone. My name is Aaron Strauss. I'm a senior project coordinator for the Big Leap program, and I'm very excited to be with you here today to show a bit about our program. Apologies if anything I'm saying about guaranteed basic income in general overlaps with the last two fantastic presentations. Also very happy that more programs are being rolled out in Los Angeles. And of course, I'm always happy to answer questions at the end from everyone. And specifically, since we're a little bit farther along in our process than the other programs, if folks from those programs want to pick our brains, always happy to share best practices. So if we could go to the first slide, thank you. So as we are all acutely aware of, COVID has deeply financially impacted families across Los Angeles, in the city and beyond. These effects are particularly felt by the 2 out of 10 Angelenos who were already facing poverty prior to the pandemic. The relentless poverty experienced by too many Angelenos emerges out of a lack of financial resources, not as some think, out of a lack of judgment. I think we all could agree with that. I'm still on the previous slide, apologies. While Angelenos are doing everything in their power to achieve financial security, the burdens of a high cost of living and high cost of rent, many other financial factors, especially exacerbated by the pandemic, make it difficult to survive here in Los Angeles. And we know that employment alone cannot always break the cycle of poverty. And as we've learned, a lot of our applicants are full-time workers. But research has demonstrated that direct cash aid, such as guaranteed income, is a great tool to ensure greater financial stability for the most vulnerable Angelenos. Next slide, please. So Big Leap will be the largest guaranteed basic income program of its kind in the US so far. I think the county comes close, and I know the state's rolling it out too, as is Chicago. I certainly wouldn't mind if we are ultimately beat, but for now, we're the largest of our kind in America. The program will be providing approximately 3,200 individuals with $1,000 a month for 12 months. The payments are unconditional, regular, and direct. That means there are no requirements for participants. GBI programs, as you may be aware of, are founded upon the belief that people enduring poverty are best positioned to make informed financial decisions that efficiently address their own household's needs and don't need to be told how to spend money. So if they need to pay for rent, a new tire, an unexpected trip to urgent care, we want to empower them to do so. Participants are therefore granted the freedom to meet their most pressing financial needs without delay. And hopefully through Big Leap, Angelenos will be empowered to forge their own paths towards financial security. Next slide, please, Heather. Thank you. So Big Leap is a research study. We are partnering with the Center for Guaranteed Income and Research out of the University of Pennsylvania, as is the county, to administer the research study. Early findings from programs such as SEED out of Stockton, California show that GBI programs can improve physical, mental, and financial well-being for their participants. For Big Leap, we'll be reaching approximately 7,000 applicants. As I mentioned, 3,200 will be selected to receive monthly obligation-free disbursements of $1,000 a month for 12 months. We'll also be identifying and inviting an additional 3,800 applicants to engage in research activities as our control group to study their life circumstances and evaluate outcomes. That group will not receive monthly cash aid, but they will be compensated for their time that they take to fill out our surveys. All participants will complete those periodic surveys, which can contribute to a final report with insights that will help us best support Angelinos in the future with other anti-poverty programs, and hopefully add to the growing body of evidence that shows quite simply that guaranteed income programs work. People spend money in ways that support them and their families. There's no abuse of our system, and that this is a great way to fight poverty. Next slide, please. Here are our 5 basic eligibility criteria. The first is that you must reside in the city of Los Angeles. It's not available to folks throughout the county or in unincorporated areas, but just the city of Los Angeles itself. You also must be 18 years of age or older at time of the application. Likewise, you have to have at least one dependent child or be pregnant. And we define a dependent child as a child under the age of 18 or a student younger than 24. You have to have income level at or below the federal poverty line, which is determined by the size of your household. And then you also have to have experienced economic and or medical hardship related to COVID-19. Those are our 5 criteria. Next slide, please, Heather. Thank you. This was our application process, which took place from October 29th to November 7th. And I'll get into where we are in our timeline a little bit later. But broadly, the application process started at our website, bigleap.lacity.org, which I encourage all of you to go to. It has some great resources and information on guaranteed income in general, and more specifically, this program. Folks completed a pre-screen questionnaire, which verified that they meet the eligibility requirements. That was just self-verification. So we asked them how many people are in their household, level of income, et cetera. And if they met those requirements, they were moved on to a survey that was put together and validated by the University of Pennsylvania team, which collected their initial information for the research component of the pilot. And I believe the next slide has some example questions. A note that the answers to these questions do not impact participant selection at all. Selection is completely random, and no one outside of the research team had access to survey responses or personal information beyond that which was necessary to administer the program itself. So please keep that in mind. We're selecting people randomly, but each council district has a number of participant slots that is proportional to 2 things. One is the rate of poverty in that district. So the districts that are experiencing more poverty have more slots within our program. And the second is we received some additional funding from individual council district offices. And of course, their funding is specifically reserved for residents within their specific council districts. Other than that, it came from general funds from Los Angeles. So these are 2 sample questions from the research survey, just to give you a flavor of what that survey was like for our applicants and for what similar surveys will be like in the future. Since every 6 months, we'll be asking both the treatment and control groups to complete surveys. The first question on the left here asks about physical limitations. Like, are you limited a lot, limited a little, or not limited at all when it comes to running or lifting, climbing several flights of stairs, walking more than a mile? So establishing basically like a physical well-being baseline. And on the right-hand side, it's a financial question, asking if folks could handle a major unexpected expense, if they're concerned that the money they have or say of won't last. So as I mentioned before, we're trying to measure folks' financial, emotional, mental, and physical well-being, their family situations, some more sensitive questions as well about their specific life circumstances, just so we can understand who they are, and then hopefully understand how their lives are improved by this money. Now getting into our selection process, if applicants are selected to receive guaranteed income, they are going to be in our treatment group, and they will be notified very shortly by the Big Leap team via phone, mail, and email. Again, I'll get into our timeline in just a bit, but we're very close to selecting our final participant cohort, and notifying them. Likewise, the control group team will be handled by our research partners and notified shortly after we notify and onboard our treatment group. And then if applicants are not selected, we will not be contacting them. We'll just be updating our website to let folks know once the program is fully rolled out and all selections have been made. And here is a bit about our onboarding process. So once we contact our applicants, we are going to be leveraging family source centers throughout Los Angeles. I don't know if all of you are familiar with the Family Source Center network, but there are 16 of them throughout Los Angeles, and their staff will be conducting on onboarding meetings, which largely consist of the following. The first step is eligibility verification. So at this point, we will ask that onboarding staff, apologies, the screen was blocked there. Onboarding staff will collect documentation from all prospective participants to ensure that they meet the 5 aforementioned eligibility criteria. So for example, a government ID that shows you live in Los Angeles, pay stubs to show that you lost your work due to COVID. We don't want this to be very burdensome, but we do need folks to show that they meet the verification requirements, but there's no further documentation that we will request. If they move on from that step, they will move on to benefits counseling, which is optional. And we want to ensure that participants understand potential impacts of guaranteed income on their existing benefits. A note here, we're working with great folks at the county, state, and federal levels to ensure that as few benefits are impacted by this income as possible. We're looking for waivers to ensure that $12,000 in folks' pockets really means as close to $12,000 in folks' pockets as possible. And then the last step here is once benefits counseling is done, we will be distributing debit cards from our great partners at Mocafy. So everyone will have a debit card, an immediate response card from Mocafy, similar to the Angelino card, in their hands with their names on them after their appointments. And we're also partnering with T-Mobile to offer free cell phones to participants who don't have devices, just so we can make sure that we can stay in touch with everyone from our program throughout the life of the program. So that's largely the onboarding process. And here are some key dates in the timeline of the program. As I had mentioned, the application period was from October 29th to November 7th. We are about to select our applicants next week, and then we'll shortly after that start our outreach process ahead of making appointments at the FSCs in early January. So throughout January, we'll be having the appointments that I just described, where folks come in and then receive their cards. And then hopefully we're shooting for January 25th for the first cash distribution. And then afterwards, we anticipate that we'll need to onboard additional people because some folks will not respond to us or will drop out of the program for other reasons. So we want to fill as many of those 3,200 slots as possible, but we're still aiming for a January 25th for our first cash distribution, which means that the last cash distribution would be a lovely Christmas gift for our families in late 2022. And that's what we're going for. Additionally, after this, we'll be engaging with some of our participants in a deeper way for a storytelling cohort. We'd love to hear how people's experiences are with the program. So we'll be finding families and participants rather, who are willing to share their stories. That part is still being fleshed out because we're deep in the weeds on our onboarding process right now, but that's the plan after everyone has money in their pockets. And I see lots of great questions coming through, which I'm happy to answer. I first wanted to give a huge shout out to all of the partners in this program that have made it possible, including Mayor Eric Garcetti, Council President Nuri Martinez, Council Member Curran Price, Council Member Marquise Harris Dawson, the entire Los Angeles City Council, the City of Los Angeles Innovation and Performance Commission, the Mayor's Fund for Los Angeles, Mayors for a Guaranteed Income, and of course, our research partners at the Center for Guaranteed Income Research at the University of Pennsylvania. I believe that's all I have for everyone. Thank you very much for listening. We're really excited about this program, and I am happy to answer any questions.
Thank you so much, Aaron. You are not alone in your excitement over these programs. I think we have a lot of excited people around the table here. One of the questions we have in the chat is, how are these programs being marketed to the community? What is the outreach mechanism by which you're attracting people or informing people about the program?
That's a great question. I'll also defer to counterparts of the other programs after I give a brief answer. We leveraged city council district offices because they know their participants best. And we also leveraged a network of what we call the community partners, where we got put in touch with 50 plus CBOs who also had client bases and were able to do more culturally and language relevant outreach to their particular constituents. And then also the family source centers were available for that as well. So we tried to get deep into the communities as possible, offering outreach in language and also via traditional methods like social media. And there was a lot of earned media after our press conference. So this was all over the radio, all over the internet, all over TV, especially in Spanish, which was great.
Thank you so much, Aaron. Yeah, and Carrie from our LA County partners echoes the same, saying all of the different media channels that were described in the chat are being utilized and making sure that it's language accessible to multiple communities. We have another question about a question about the withdrawal limits on different benefits cards, mentioning that there were some problems with the recent program, the rent relief program, and wondering if there's any concern there with this new program being rolled out.
I am not aware of any concerns. I haven't heard any from my team, but I can definitely take that back. I don't have the answer off the top of my head.
Thank
The
you.
issue was with the bank that was being used for the Angelino card. MoFi or Mokai, I can't remember what
Mocafy?
Mocafy, yes. There was issues with that card with folks not being able to pull out and being charged fees when wanting to use that card. So I guess for me, it's a concern that is being used again in this program when it had already had a lot of issues that I don't believe got a full resolution. And I don't know, Pamela, I know you were more involved in those conversations, if you have updates on the resolution to those issues.
Thank you, Ruby. No, I don't have updates on the resolutions to those issues, but you are totally on point that was an issue. The withdrawal limits at some point were just raised, above 1,200, but I don't know where we are today.
I will take that back to the team. We definitely don't want our participants to experience any issues with their cards, and we definitely don't want them to be charged any fees for any activity on the cards. So appreciate that flag, and we will try to make sure that folks don't experience the same concerns.
Yes, thanks for raising that. Any additional questions? We still have with us Carrie Miller, we have Sean and LaShonda and Aaron. So 3 incredible programs that are launching next year. It's very exciting that LA is part of this, this research initiative, and that some of our Los Angeles residents will be able to really demonstrate how these programs work and how they work best. Well, thank you, everyone. It sounds like we don't have any additional questions at this time, but I know we would love to hear some regular updates from all of you to just see how the recruitment process is going, and then obviously what the learnings are. So very exciting stuff. Like I say, I can't wait to hear more in the years ahead. So thank you all so much for joining us today. I greatly appreciate, again, Aiden Pasabani's help to get this launched, and anyone who has questions and additional interest in the program, we have contact information for our presenters and we can reach out to them directly. So with that, I will thank you all very much for your time today. Oops, sorry, got to get through the Tapertunity slides because I put them out of order. Oops, and now here we go. All righty, next up, I'm delighted to welcome my colleague, Rosa Soto, to give a quick update on the Care First Community Investment Program.
Hi, everyone. So we're almost through. Thank you so much for your incredible attention to this effort. I wanted to talk about Care First Community Investment. We had talked a few meetings ago about what kind of funding might be available for our most vulnerable communities. One of those is through the Care First Community Investment Program. You might remember Measure J, which was voted in by our voters in LA County back in 2019, I believe. maybe early 2020. Let's go to the next slide, Heather, and see if I can share just some highlights. What I would like to do in the future is to invite the Office of ATI to come, Alternatives to Incarceration, to come and help us present on what their portfolio is like right now. The advisory committee that has been selected to support the selection of funding and advising the county and how they're distributing Measure J funds. We'll be putting together a plan for years 2 and 3 over the next a few months. So it's an important time to get involved in this project. The direct community investment alternatives to incarceration funding was identified in these 9 areas: youth development and education, workforce development, small business development for minority-owned businesses, rental assistance and housing supportive services, capital funding, pretrial non-custody services, treatment, I'm imagining substance use disorder, community-based health services, non-custodial diversion and reentry programs, excuse me, and community-based restorative justice programs. As you know, there is an incredible amount of funding. I believe it's about 190,000 on average every year. I'm sorry, 190 million on average every year. So we're super motivated to see the funding go, to the right resources, to the right community, and to the right individuals, right, in each of our communities, the most vulnerable. So, and the equity lens, I think the equity lens being so important, not just about distribution of equal resources across the 5 supervisorial districts, but in particular, that real equity frame to where the highest needs are. If you can take me to the next slide, Heather. So Measure J funds focus on equity, contracting, and ensuring that 85% or more of the dollars that were identified through Measure J go to community-based organizations. And so if you can see this priority list, again, this was work done by the advisory group in the first year, organizations and groups and programs to be prioritized for funding. So that means, really looking at the larger understanding of who is doing this kind of work and how do we improve the distribution of those funds to those that are doing great work. Grant funding methods and practices to distribute Measure J funds, implementing strategies to ensure accountability and transparency, creating transformative and sustained change to achieve a care first, jails last approach. And then impact of the Measure J funding, maximizing, leveraging, and matching opportunities to be considered with other funding streams to scale up Measure J programs and interventions. So that importance of the integration and intersection, not just development of new programs. And then ensuring Measure J programs are culturally responsive and proficient. So there's a framework here that was set in the first year. And so very recently I was appointed as our SD1 advisory member. And I also have a wonderful colleague that I have so appreciated having, very close interaction with over the past several months, Jose Miguel Idris, who is on the call with us right now. He has turned on his camera so you can see him there. And, he'll talk a little bit about himself in a second. We are participating in these meetings and ensuring that the framework that was identified through year 1 is evaluated by this new advisory group of year 2, and also, addressing any of the concerns that occurred during that first year, right? And that quick ramp up of the work. So let's go to the next slide. All right, so the committee structure is quite complex. There are 8 county departments appointed to the group, and these are the first 8 on this list: Health Services, DMH, DPH, Parks and Rec, DPSS, Consumer and Business Affairs, WEDAX, and the Development Authority, and then 1 representative from the Anti-Racism, Diversion, and Inclusion Initiative, 5 representatives from community-based philanthropic and advocacy organizations appointed by each supervisor, 2 labor representatives, one from each of the following, SEIU and Southwest Region Council of Carpenters, 1 representative from a faith-based to be selected by LA Voice, and then 2 transition age youth who live with lived experience, right, and direct knowledge of the juvenile justice and child welfare system. Also, 1 member of the with lived experience of housing insecurity and homelessness to be selected from, Homeless Services Authority, LEAP, and then 3 individuals with lived experience or direct knowledge of the criminal justice system, and 1 non-voting member from CEO ATI. This group meets probably about twice a month. We've had a few months where we've had special meetings as well. And so I've noticed that there is an incredible amount of participation. At some meetings were between 120 and 150 people. These meetings, in our non-holiday months, we get 60 to 70 people. So it is quite an extraordinary group. However, Jose Miguel and I had noticed that there isn't a lot of representation from SD1. And as SD1 representatives, we wanted to make sure to bring this to your attention, to invite you to be a part of this process with us, because it's the only way that we can ensure that we understand from you all what priorities exist in our community, right? We had a presentation yesterday, and I'm going to pause for a second to have Jose Miguel introduce himself and talk a little bit about his observations from yesterday, if you'd like, Jose. We had a presentation from the evaluators that are looking at particularly where the highest concentration of high need populations are. And it was quite extraordinary to see those very dark colors around certain zip codes, right, that we know and, work very closely with. So, we definitely want to make sure that we understand the needs of our communities and our neighborhoods and make sure that we're uplifting those needs through this process. So, Jose, can you say hello, please? You may have frozen. Jose, you there? All right. We will pause for a second in inviting him in. I'll continue, and then hopefully he can join us again. All right, let's go to the next slide. For year 1, the spending recommendations totaled 170.9 million across 6 categories. And there is an incredible report. We can put that in the chat or send it via email. But just wanted to make sure that you saw where the distribution of resources were for the first year. Obviously, this 30% going to the closing of Meth Central Jail is very much in line with HICP priorities. 20% diversion, behavioral health, and health, also very much in line with the work that we're doing around the restorative care village and reentry, housing, and then education, access, youth, and economic opportunity and sustainability. So it looks like a very robust portfolio. We're beginning to get some of the presentations of where that funding is going currently. There's been a lot of conversation from the committees about when the money is going out for community-based organizations. What I understand is there's about 59 million that's going to be identified to go out into the community. And right now they're going through the process of identifying the third-party administrator so that the granting process isn't as cumbersome as it normally is through the county process. This challenge that HICP has lifted before, where we don't necessarily always have best opportunity for smaller nonprofits. So we want to make sure that we're always identifying some of those resources that can go directly into the community. And then the second part of that is a community engagement lead and partner that can help each of our advisory group members in each district identify a community engagement plan to ensure that we're disseminating the information as best as possible. So I see Jose may have come back. Jose Miguel, are you there? he's having some technical difficulties. I am so sorry. Jose Miguel runs an incredible, I believe it's a 2-acre plot of land in South El Monte called Cultiva LA. It is right off the 60 freeway on Santa Anita, and he's incredibly gifted at their program development and implementation, and truly trying to find sustainable strategies and efforts to ensure that the participants not only grow their own food, but can use it as an economic business opportunity. So I'm just super grateful for you. So Jose, you may not be on camera, but I see your hand up. Can you hear us now? Oh, that is so unfortunate. You guys will meet him in the future. All right, let's go to the next slide. All right, so this is the membership advisory roster. I apologize that it is so small, but it is a lot of people, as you can see. And so we grouped them into the board appointees, the county leads, the and then the other representatives there. So it's helpful, to know who your representatives are and how you might be able to reach out to become involved in how the funding is being identified, and how we work with the departments, right, to advise them as best to ensure the quickest turnaround for this funding to go out into community as Measure J had intended. Let's go to the next slide. I believe I only have one more slide. There you go. That was it. Okay, so any questions from anyone? Oh, we do have, let me share the dates. We can put these in the chat. I believe we just got a new roster last night, so I apologize, it didn't make it into the deck, but December 16th is the next meeting at 4 p.m. January 6th is the meeting after that, and then January 20th is the meeting after that. The next 3 meetings are essential in terms of identifying some of the framework and advisement around community engagement work. So we would love to invite HICP members to that environment. We will send this out again for everyone. Any questions on this? All right, well, we thank Supervisor Solis very much, Miguel, Jose Miguel and I, for being appointed to this advisory committee. We are super grateful to have a voice that can be part of the discussion of the highest needs of SD1. And then, just asking all of you to ensure that you take a look at this group and join us for meetings. And Ari, what are you sharing with me? So you're sharing a priority around awareness of an LA County jail program that has for LGBT and transgender inmates, and it'd be best for them to avoid a revolving door for incarceration. Yes, absolutely. We haven't gotten into the details of these types of programs, so if you can share more with me or direct me to, it could be some of the the priorities that we place in the comments from SD1's perspective. Absolutely. So I'll reach out to you, Ari. All right. So thank you so much. Heather, back to you.
Great. Thank you, Rosa. It's such an exciting program. My goodness, there's a lot going on in the county and on our community. So we're so excited to be able to bring these updates to you at the HICP table. So we are.
I was going to say just 170 million is a lot of money going out for these types of programs. So thrilled that we're doing it.
Absolutely. So we are at time, but I'm going to ask for a few moments with you as we conclude. Thank you to those who filled out the HICP member survey. We really want to understand, what makes this table a valuable space for you, what makes it worth your time every month. And we want to be sure that we're at the cutting edge of the issues that are of most importance to you and the community members you represent. So we did do the community survey, and these are some of the responses that I wanted to report back to you all. We asked the question of which individuals and organizations that should be in the HICP meeting space but are not yet well represented. Who are those, and then how do we reach out to them? We heard that there is interest in having more representation from job training and development sources, from the LAUSD school district, victim services, additional student services, as well as law enforcement, labor leadership, and the Asian American community, all of which are wonderful recommendations. And we will bring this information back to our co-design leadership table to discuss how we can implement on some of these recommendations that you've presented to us. We also asked a question about ways to engage more resident leaders, and we got some good feedback about really reaching out to the community more deeply, training people to participate, and then of course finding ways to really emphasize the value and importance of HICP to resident leaders. We also asked, you know, kind of how does the balance of sessions, the number of topics, the number of speakers, the density of our presentations, how is that resonating with you? Overall, we received feedback that we are on track and we're doing a pretty good job of balancing out the interests and the topics and the speakers that you most want to hear from. We also asked what you like best about our 2021 meetings. And we heard back some great feedback that the meetings have been very interesting, that Zoom has made it convenient, that the meeting materials are available after the meetings, that the COVID-19 updates keeping us really up to date on this, you know, global issue that we're facing at every level of the community. And last, that the continuity of these meetings with the project's vision. And you'll see on this particular slide, you'll see those 7 priority areas that were identified early days of the HICP project, and how we're really continuously reflecting back on those issue areas to ensure we get a nice balance of presentations and topics covered in our sessions here. We did like also, let's see, one additional question that was added: what meeting format do you prefer for 2022? We heard 100% of our respondents said that they miss in-person meetings, but they like the convenience of virtual, and so proposing a hybrid approach, and that is what we will continue to do. When this time becomes available for us to meet back in person, we certainly look forward to that, but we also do believe that we will keep a virtual option always available so that people can join us via the Zoom channel. We also asked, you know, going forward and looking into 2022, what are you most interested in hearing? We heard from the respondents that mental health services, the restorative care village, COVID-19, campus projects and local development, jobs, workforce development, housing, Men's Central Jail and Juvenile Hall, the USC Master Plan, community safety, parks and open spaces, and civic arts. Those were the topics that resonated most with people responding to our survey. So we will really bring that forward to co-design to focus on those issue areas as we build our agendas for the year ahead. We also asked for additional recommendations for how to make these meetings more meaningful and more powerful. And we heard that increasing resident leadership participation, as well as disseminating the information from these meetings more broadly, inviting others to join the governance committee. And then we had several here about making the presentation more broad-based in terms of its dissemination, either through using county, city social media channels, or even using something like a LinkedIn profile and channel to kind of promote the messaging out more broadly and allow people to connect with the HICP membership in a different way. Also a request for more community presentations and more individual/fun presenters, such as DMH celebrity spokespersons. So I really appreciate those that responded. We love getting your feedback. We love the recommendations and the ideas and the creativity you share with us. And we look forward to bringing those forward into the meetings that we will plan for the year ahead. With that, I believe we are done for the day. So unless there are any partner announcements, we can go ahead and wrap things up. Our next meeting will be the first Friday in January, which is January 7th. We also have a new set of meeting links. The meeting code for this Zoom meeting will continue into next year, but we have a whole new set of meeting links that I think Sophia can add to. Sophia, if you can add to the chat the link that people can click through on so that they can add all of these meetings to their calendars for the year ahead, that would be terrific. Are there any final concluding thoughts, any partner announcements as we wrap up December's HICP meeting? Ms. Anapar?
Heather, I have an announcement. May I share the screen real quick?
Sure.
Okay.
Let me see if I can stop sharing. So you can. Yes.
Okay. My announcement is to just let folks know, I know we had a presentation earlier this year from the California Department of Insurance. They have the California Low Cost Insurance Program. This is a program for folks who are income eligible to receive insurance at greatly reduced rates as low as $244 a year to up to $966 a year. Again, if they're income eligible. So I know that, you know, folks are trying to save money and find supportive programs to help them manage their budgets better. And this program should help for many of our constituents who are income eligible and impacted by the COVID-19 pandemic. So program information can be obtained at mylowcostauto.com, or feel free to reach out to me and I'll direct anybody to this program as well. Thank you.
Thanks, Anna. Do we have any additional partner announcements, concluding thoughts as we wrap up our year?
Hi, Heather, it's Alex.
Hey, Alex.
Hi, good morning. Just wanted to announce to everybody from the East Los Angeles Chamber of Commerce that on the 18th at Centro Maravilla here in East LA from 10 a.m. to 1 p.m. that we will be having our annual toy drive for distribution of toys to kids. So just, you know, happy holidays, everyone. And I'll be sending out the flyer to the group, and hope you can share it with those in need and anybody who just, you know, like to get the kids something.
Thank you, Alex. That's wonderful. So if anyone's interested in participating or learning more, please reach out to Alex Villalobos. Anyone else? All right. Well, with that, I think this puts the finishing touches on an incredible year of HICP meetings and presentations. Very excited that you've all joined us, not just joined us, but stuck with us through this entire journey of the last year. It's been quite a wild ride. Looking forward to turning a new chapter and a new leaf in 2022 and continuing to keep you updated, informed, and engaged on things that are impacting East Side communities, residents, local businesses, students, and of course our beloved LAC USC Medical Center campus. So with that, happy holidays, everyone. I hope you have a wonderful rest of December, and we can't wait to continue the conversation with you on January 7th.